also a active healthcare and entrepreneurial advocate yourself here in Oregon, and I would love to know what your thoughts are, big picture, on the current state of healthcare and how it needs to progress.
Yeah, it's a broad question in general, in the sense that we like to joke, other founders and I, that that healthcare is sort of 15 different economies in one and areas in one, and
Right.
so. But there are some, I will say, there are some underlying threads across healthcare as big picture. I'd say that if you look at the moving parts in healthcare, one thing is for certain, that there's more people, and there's more treatments and more ways that we can help people with new treatments. And at the same time, there's more and more economic pressure on the system to deliver all this new cool stuff that's expensive to create to more people and faster and a higher volume. Mm-hmm. So just right there, you have this tension that's been building up for a long time. The cost of healthcare plus the increased ability to help people. So how do you reconcile that? Then you layer in all the global economic and political complexities of today, of like all the healthcare systems are different, yet we're really living in a singular global economy, and the currencies and cryptocurrency and all. Now there's even more pressure on delivering it, within the context of your governmental regulatory framework as well. So I tend to look at it, I mean, you just take a high level of healthcare. It's the cost of it, it's the delivery of the actual thing, and then it's this regulatory, economic environment sits on top of, and so with that being said, I think the general path for healthcare is the only thing that can reconcile all that complexity, really, or most of it, is technology, right? I mean, that's the only thing that can deliver more for cheaper over time. And so that's not even in our area. If you look at the clinical AI stuff, in the US, there's a lot of pathologists are being replaced with clinical AI. Parts of radiology are being supplemented or made more efficient by AI that can read images. So there's already parts of the clinical side that we're seeing the real effect of that now, finally, which is awesome. And then, our area is the administrative side. I mean, nothing worse than, you can even understand that on the clinical side, because that's the actual delivery of healthcare, but it's really frustrating that just giving someone insurance and having it pay for them, like, that's causing all this manual waste and loss of ability to deliver care to people. That just feels totally unnecessary, honestly. And so, drilling down to our world, there's a lot of aspects of why that's the case and the complexity of the system. Ultimately, I think that will be, like self-driving cars, once again, will be solved with technology and AI that can move all this big data and complexity in a way that makes it easier for us and more transparent, more fair. So yeah, I think, if I had to, in a shorter answer, it's automation that brings all these complex pieces together and makes it easier for us to work.